Nice and neat. So, and then come all the way to the edge here so I can manipulate you a little bit. So, one thing I like to do with first rib is just palpate, right? Kind of into this triangular space here. And they can flex their head towards you. That will put some slack on some of that tissue so you can actually push down there. And then that first kind of hard mass that you feel should be first rib. Have you guys heard of accessory ribs at all? Yeah. Like C7 has a rib coming off, and so that's like beyond what we're going over here, but it's something that you can kind of palpate for as well, so you know some imaging. So if they are provocative to pain there, and they feel like they have a stiff neck and they're maybe getting some symptoms, you can assess this. This is your rotation and lateral flexion test. So if you want to assess left first rib, you're going to actually passively turn the patient's head to the right, so opposite side of the rib, because we're trying to put tension on the scalenes. Does that make sense? And then you're going to flex them down, side flexion. And actually, what we need to do is kind of stabilize a little better, keep in that position, and you're going to kind of assess that end feel and flexibility compared to their opposite side. Okay? So what you'll notice is if someone does have hypomobile first rib, they're going to complain of either pain or tightness there compared to the other side. That'll be pretty consistent with what they've been feeling. So that's first rib. What I want to do there is do a retest of kind of the mobility of this rib. So I go on and feel, try to assess if it's hypomobile, and then do that test and see if we can do some like joint mobs, and then retest that test, see if their motion improves. Now this is like a combined cervical spine motion, so it's going to be hard to measure, but as far as qualitatively, let's see how the patient feels too. So if one of you guys has this is tensioning a nerve, right? What do you think would kind of relax a nerve? Probably flexion towards, arm here, and wrist flexion, elbow flexion, right? So we're putting laxity through that nerve, and their symptoms are relieved. So if you have a patient coming in and they sit down, the first thing they do is just this on the table, and you're like, well, what's going on? He's like, oh, I just get this structure. It's the only position of comfort for me. Boom, positive, right, for probably radiculopathy, and then you can kind of piece that together in your whole exam. So explain to the patient, these a lot of patients, they get all those symptoms, right? Spurlings here, everything. You can say, help do this for me, and if their symptoms are relieved, they're gonna like love you forever. I never knew that. So practice those, explain that to the patient and why that the base of the occiput. Yeah, thank you. And then you're gonna slide your finger right off the edge, right in midline of the cervical spine, until you feel the spinous process of C2 or the spinous process of the axis, right? So coming down, so right there, right? And you can kind of flex and extend to feel that jut out. So you can flex this forward, you can feel the spinous process jut out there. And you're gonna use a pinch grip, like this. And you're gonna place your fingers right around the edges of that C2. So you kind of flex and extend here to find that C2. And then you're going to provide a palmar force forward as if you're trying to shear her head backwards on her AA. Okay? So she's here, you're providing a force, and then what I would tell a patient to do is just gently nod your head up and down, right? And if you feel a clunk, or it goes clunk, right? Or they start getting a reproduction of, actually a relief in symptoms, then that's positive for instability. Why do you think it's a relief of symptoms? That's positive. Exactly right. So if they get stability, resist those two ligaments.
Rotation.
But what rotation? Ipsilateral, contralateral. You got it. Cool. So knowing that will help you know what you're doing with your hands and what you're feeling for. So if you lay down on your back, unless there's another volunteer. You lay down on your back, head at this end. Good. And let's just move this up for my comfort. So you're going to do that same kind of pinch grip there. And it doesn't really matter which hand you use. I like using my right hand because I feel like I have a little more dexterity. I can feel. And then because I'm right-handed, but my left hand is just kind of like that mover arm. So I get into like a little bit of a lunge position. She's a little far away from me, so I'd say come just a little bit closer. And I'm going to cup her hand with her head with my left hand. But I'm going to palpate that same area, and I'm going to place my fingers right on the outside of her spinous process of C2. And then all I'm gonna do is very, very gently capital side bend, boom, boom, boom. And what I'm trying to feel is a little bit of tension that direction, or tension this direction. And what I feel is actually when I side bend her to the left, her contralateral side, I feel her spinous process sort of move into my finger on that side. If she was unstable, you wouldn't feel that end feel, right? Feel like an empty end feel, and it would just feel different. So how do you guys practice that? You can also do rotation. So same thing, contralateral rotation is stopped by the alar ligament as well. So if you're just kind of doing just this gentle stuff and you're not feeling that pressure going to your fingertip on the contralateral side or whatever you're side bending or rotating, then they might have some alar ligament laxity. I'm taking good care of her ears. I know when I was a student, I had partners and they would grab my ears like this. I freaking hated it so much. I had an ear complex or something. But you're gonna take your thumbs and place them just kind of on her mandible. And then all we're gonna do here is sort of translate her head up, kind of like a jet forward motion, like that. And if they get a clunk or reproduction symptoms, then that would be a positive test. Or if they're feeling like there's a lump in their throat or something like that.